Hi guys, and welcome to another 12 hours long night shift on the step down ICU unit. So many of you have been loving these videos, and so I am always so excited to make these videos. So follow me on this night shift, a long 12 hours night shift after 2 days of rest, and we'll be seeing what happens during this night shift. I was so happy when I got onto my unit, and so after getting shift report, I will be taking a brief restroom break. Then I'll be briefing you guys on my patients. So guys, I just finished getting report right now, and one of my patient has a lot for me to do tonight. Apparently the patient has like so many drains, a JP drain, a belly drain, ostomy, wound vac, and a chest tube. So tonight I'm also going to be doing an Alteplase for the chest tube. An Alteplase is a clot buster. Usually it's done for patients who have like blood clots to the lungs. So tonight seems like it's going to be a busy one, but we'll see. An Alteplase is one of those skills that I feel like I get to do it like once a year. But tonight I'm going to be doing it, and hopefully it's going to be a calm night. So I went ahead to let you know all of this because I wanted you all to know like the kind of complexity and severity that some of the patients, or acuity of the patients that we also have on the step down unit. Sometimes we have this kind of acuity, and it's up to us to take care of these patients and make sure that they are safe. So I'm going to be going back out there, and I know for this patient there's going to be a lot of notes. So I'm going to make sure that I read everything, and I'm very versed with what has been done and what is yet to be done. Honestly, I had this patient last week, but coming on today, seems like a lot has happened, a lot has changed for this patient. So there's obviously going to be a lot of note reading and digging, looking out at the labs, doctor's notes, pulmonology, GI doctor, and all that good stuff, as well as PTOT, respiratory, and all of that. Especially with patients on Alteplase, another thing I should let you guys know is that it hurts a lot when you're pushing the medication through the chest tube. So most of the times these patients would love for them to have like pain medicine before you do the Alteplase pushing. But during bedside shift report, she actually verbalized that she wanted some pain medicine. I had to give her the pain medicine like right away, but I know that the Alteplase is scheduled in like 2 hours from now, and I know she's still going to ask for some pain medicine. I'm going back out there to read my notes and get my day started. It's now time for me to start reading through all my patients' notes. Like I always say, I love to read through my patients' notes, because that is where you get the in-depth information regarding to everything that has happened to all your patients. You will be looking forward to what to do to the patient and what is yet to be done for the patient, the future care plan, the future plan of treatment for these patients while they are still in the hospital. After reading through my notes, I always go now to pull out my medications, because at this point, if I know that the patient is scheduled for any procedures, I know what to hold and what to expect to do for my patients. I always look forward to reading all your comments. So if there's anything that you have questions, doubts, you want me to clarify, please drop it in the comment section, and I'll be very sure to respond to your comments, or I will be making a video just to answer your burning curiosity. I would also love to know how many of my viewers, subscribers are step down ICU nurses, and those nursing students who are aspiring to come to the step down unit, so I can make more videos to enlighten you and to shed some light as to what you should be expecting. So my patient who had a chest tube, because this is obviously something that hurts a lot, especially knowing that the patient will be getting this Alteplase, they were having a scheduled pain medicine as well as a PRN pain medication. So after I had administered her pain medicine or her scheduled medication, I had to now proceed to pull out my other patient's medication, because I wanted the pain medicine, or I was trying to give the pain medicine time to kick in before I come with the Alteplase and her PRN pain medication. So the same patient with the chest tube had an earwax removal, a Lovenox, and some other medications. But like I said, I had to give them their pain medicine just so that it could prepare them for the Alteplase. Same patient was also on contact and droplet precaution, and here I am gowning up, getting ready to go spend at least 30 minutes in the patient's room. After that, I finished up by cleaning the patient, emptying ostomy. The patient had number 2, a bowel movement, so I had to empty the trash and kind of look for a Foley start lock because the Foley was kind of dirty, and so I had to take off the old one and place a new one on the patient. So most of the times with these patients who are on precautions, you always just want to cluster your care. Make sure that when you're getting in there, you're doing everything at once for the patient. So previously I had given them their pain medicine, then I had to come back and pull all the other medications for all my patients. And then, this patient was the last one to be attended to because I knew that I had to spend at least 30 minutes in their room with everything that I had to do in the patient's room. Normally, when you're pushing this Alteplase, depending on how the patient tolerates it, most patients will not feel the pain. So you can push it within like 30 seconds. But with some patients, with the severity of the pain, they would want you to push it very slowly. So like I said, I had to spend at least 30 minutes in the patient's room pushing this Alteplase. And so I had to make sure that I cluster my care in this patient's room. At this moment, I want you all to take a moment to please like, share and subscribe to my channel, because this encourages me to know that people are loving what I share and to make more of these videos. So after a while, the patient called again for their pain medicine because they were in excruciating pain, and so their scheduled PRN pain medicine was ready to be administered. So I had to pull it out and go administer it to the patient. Most of the patients on this floor have high oxygen demands, and so we work very closely with the respiratory therapist.
Can you please check his blood sugar? He has blood sugar check at midnight because I'm about to move into another floor.
So the patient who had a lot of things that had to be done in their room did not have enough table space, room for me to place my things on the table and do what I had to do. And so I had to get another table from another patient's room, clean it down, sanitize it before taking it into the room of this patient. It was now time for me to catch up with my midnight documentation after transferring or downgrading my patient onto the med-surg unit. Then it was time for me to take a quick lunch break because there was still a lot to be done, a lot to be documented, and a lot to read up and a lot to update myself on what is to happen for my patients. Now, one of my patients was now scheduled their IV antibiotics, and I had to pull it out to administer to the patient. Like I always say in all my videos, the acuity of the patients on the step-down ICU unit is very high, so you have to be comfortable in using your critical thinking, knowing what and when to do for a patient, knowing when to reach out to the provider, and being comfortable to know when to call a react, a code blue, and perform a CPR on the patient. It is now time for me to check on my patients to make sure that their vital signs are stable, to make sure that they are sleeping good, overall to just make sure that everything is in order and to make sure that I know what is going on at every second. So my patient with the chest tube also had a wound vac and the side was actually leaking, so I had to quickly come and pick up some wound care dressing items so that I could change the side and prevent any infection from spreading in the patient. Guys, we are more than halfway into the video. Please encourage me by smashing the like button, sharing and subscribing to my channel because it honestly encourages me to make more of these videos, spread the word about the step-down ICU unit and also enlighten you all. I also had to do oral care for the same patient. So I had to pick up everything so that I walk into the patient's room and do everything whilst I was in the patient's room. Oral care is especially very important with patients who are NPO because they are not having any food or fluids or water through their mouth, and so their mouths are usually white, gunky, dirty. Sometimes they have an odor, and so you also want to make sure that you're keeping them clean and hydrated by giving them some oral care. I have honestly made new friends from nurses and aspiring nurses from different countries, so drop down in the comment section where you're watching me from and how nursing is different in your country from the US. Another thing with most of the patients on my unit is that most of them will have Foleys, and so we tend to do CHG bath for these patients or Foley care on the patient. So this is me getting my CHG wipes to do my Foley care. Now my patient on a chest tube, it is always recommended that they use the incentive spirometer that is going to help with their breathing. How this apparatus helps in their breathing is that they tend to inhale or suck in the air from the apparatus, which helps in the lung expansion and making sure that they are getting enough oxygen to oxygenate their blood. For most stroke patients, it's always recommended or standard or protocol to use an SCD pump on their feet. So I had to hook up my new patient who came on the floor or under my unit with their SCD so that it prevents blood clots, which can lead to strokes. It was now time for me to follow up or start doing my 4 a.m. documentation, documenting my I's and O's, basically making sure that everything that has happened throughout the shift is being documented, putting in my nursing notes, and making sure that I documented my reassessment and assessment done on my patients. It was now time for me to pull out my 6 o'clock medications. On this day, I had only 2 patients that had 6 o'clock medications. Most of the times, it's not every patient that gets 6 o'clock medications. And so for the few that have 6 o'clock medications, sometimes, especially if the patients are scheduled for a procedure and their NPO, you won't give them their oral medications. You have to be aware of that. And one thing you should also know is that most of the times when patients sleep at night, their blood pressure and their heart rate may be slower. And so for those patients who are scheduled 6 o'clock, maybe late 6, you have to always make sure you're monitoring their blood pressures. One of my patients also had an order for a nasal swab, and so it was time for me to go collect the specimen and send to the lab. Sample has been collected. It's now time for me to tube it to the lab. Most of the times at 6 a.m, this is when we kind of round up on our documentation, making sure that we've documented all vital signs have been validated, all outputs and inputs, every intervention, making sure that labs are in order. And yes, the morning shifts are trooping in. I am so excited because it is time for me to go home. I have done all my labs, giving all patients medications. Patients are ready for the morning shift and also looking forward to breakfast and family. Of course, one of my patients had to call for pain medicine, and so since it's still within my shift, I had to pull the pain medicine and give to the patient. Typically, you are over your care for a patient when you have already given report, but because I had not yet given report, it was still within my jurisdiction or within my time frame to administer pain medicine for this patient. I won't really say this was a very busy shift, but I'll honestly say one patient had a lot of things to do for them. And so I can honestly tell you that this is a normal shift on the step-down ICU unit. The patient acuity was expected. What happened during the shift was expected. And I am so looking forward to going home and resting. If you've watched this video right up to this point, can you kindly drop in the comment section where you're watching from, how these videos are helping you? Because at this point, I'm so excited to go crash on my bed and sleep and prepare to come back for the next 12 hours. Please kindly like, share, and subscribe. Until then, I'll see you in my next video. Bye.